Welcome back to Becoming Limitless. Today is a special one because I'm joined by a dear friend of mine, Dr. David Roze. He is a biological dentist, a wellness entrepreneur, and the author of The Hidden Root. This book is not a clinical manual or a traditional health book. It is a story that explores what lies beneath the surface of who we are. The unseen roots that shape our health, our choices, and the way we move through life. In this conversation, we're going beyond symptoms and surface level optimization. We're talking about foundations, identity, awareness, and the quiet drivers that often determine whether we thrive or struggle. David, welcome to Becoming Limitless.
Thank you so much, Dr. Elie. I'm so happy to be here with you.
Thank you so much. We've had so many interactions, we've done so many things together, and I am perhaps your number one fan, and I think you know that. But this book, oh my God, I had no idea. I mean, you knew that I had my first book out also last year in 2025, and I'm working on my second one.
Oh, nice.
So I had no idea you were working on it, so it was a really nice surprise to see it. But then you told me that this is beyond, and I didn't understand what that is until I started looking through it. Even just the first chapter just knocked me out. Perhaps a father's worst nightmare.
Most probably, yeah.
I mean, your journey is fascinating. It's not just what you do as a profession, but also as what happened in your life. So, tell me a little bit about what brought about this book.
I think we have all a kind of journey, and writing this book was for me a healing journey as well. What I wanted to do is to explain what is a biological dentist, what is the field behind that, what it means, and why I became a biological dentist. And the story had a great event and a dear event into my life, very impactful. And then I wanted to write what I'm doing in my job, but I didn't want to be boring. I wanted to connect with my readers. The same as when we do a consultation. Mm-hmm. You know, I always tell our colleagues, when you meet with a patient, connect with him, try to understand what is he doing, why is he here, and not only just looking at the tooth, just the local issue. I want to understand the patient. I want to understand and to really care for this patient. So that's the goal with this book. I don't want to just give you a biological protocol of dentistry, but I wanted to go far and beyond to explain why I became like that, and to maybe touch the patient or the reader in this case in order to make it more human.
Awesome. Now, I occasionally refer clients to you and you take great care of them. And the question I'm asked most whenever I say you should go and see a biological dentist is, what is a biological dentist? So briefly, before we dive into the book,
sure,
just let people know what is, or what do you do as a biological dentist? What is the difference between a biological dentist and a traditional one?
We have a tendency to think that dentist is more a great technician, drilling tooth, giving veneers or a crown, and we need to go deeper than that. We need to understand that each tooth is connected to the rest of the body. The nerves are connected, the blood flow is connected, everything is connected. So if you don't look at symptoms overall, or chronic disease, or anything that can impact the whole immune system, then I feel that you're not doing properly your job. Mm-hmm. So being a biological dentist is trying to find the hidden root behind every kind of symptoms. Maybe there is a root or an infection or inflammation coming from the mouth that creates such disease or symptoms or chronic pathology.
Right. One of the latest clients that you had, they just had, I think, a root canal or something. They did some final work with you, and he felt this amazing release in his gut. He's, lots of gas that is kind of coming. So there is a direct connection between, obviously we've known for decades, the direct connection between our mouth health and heart health and so many other aspects of our bodies. But to directly connect, because you've shown me a chart before, I don't know if it's in a book actually, but it is on your website. You've shown me a chart of how each tooth is connected to a different part of the body.
Correct.
And you believe that and you work around it. And this is not something you've created. This is...
No, it's something that's been going on and on for years and years. What I always believe is that the Western medicine is very good with acute infection. Mm-hmm. And the Asian medicine, the Chinese medicine, for example, is very good with chronic disease.
Right.
So we try to take the best out of each medicine and to combine that.
Because you have different practices, right? When I go to your clinic, I'm not walking into a dentist clinic. It doesn't feel like that, right? Yeah. So I think that's on purpose, obviously.
Exactly. Yeah.
Because you do much more than just teeth. You look at the person as a whole.
Yeah, I mean, we try to find the reason why the patient is not feeling well. Mm-hmm. And as a dentist, I'm looking, of course, at the mouth area, but I need more than that. I need a functional medical doctor to assess the rest of the body. I need a Chinese energy to assess how the patient is feeling. So that's why we have psychologists, we have a Chinese energy, we have somehow with a physiotherapist, we have all these kind of combined areas where when we need, we have the tools to investigate all the different parts of the body.
And I know that you're also do a little bit of biohacking, and you include red light, and you include other. I know that you've referred people to me to kind of use some of the equipment that we have at Restore, because you truly embody a holistic approach to everything. It just happens to be that you're doing it through the mouth, right?
Correct. Yeah. But as you say, it's a lifestyle.
Yeah.
So you need to include the red light. You need to include all these kind of tools that we have that are natural. We use a lot of natural products or natural protocols, including ozone, that are very healthy and that promote the healing. So we prepare the patients to be ready for any kind of treatment in order that during the time of the treatment and the post-op, is so much different.
You've created your own toothpaste, you've created your own toothbrushes, you have even ozone little creams that people can get, and perhaps it's one of the top 5, if I'm not mistaken, of the things that we sell at Restore is your toothpaste. People love it, and I use it myself, obviously. So you've truly kind of embodied the holistic approach, as we said.
But it was out of passion to find the right things for our patients. Mm-hmm. So I've been here 23 years in the UAE. Mm-hmm. And when we started these protocols and this process, we didn't have any healthy toothpaste. Mm-hmm. So we had to find something. It was in the States where we had to import, but it didn't make sense. It was long to get the toothpaste, and then I wanted to have something manufactured in the UAE. Mm-hmm. And then it took 3 years of research and development, but at the end we put all the ingredients that make sense, not only for the teeth, but also for the gum.
Yes.
Don't forget that in the mouth you have the hardest tissue, the tooth, the enamel, next to the softest tissue,
right?
The gum. So you need to make the most of it.
And the tongue, and and it's the gateway for your microbiome and your whole gut and all of that. So it's awesome. Anyway, we can talk about that, and we'll have another, hopefully, an episode focusing on that specifically, because I think people have lots of questions on what makes the difference. And educating the difference and educating people with the difference and helping them to kind of go to someone like yourself and the team that you have with you. And I know you have 3 different locations in the UAE, and you're extremely well known, and people come from all over the world to come and see you. So I just want more people to be aware of what you do. So instead, and hopefully more dentists will begin to do more of what you do and use your approach a little bit more, not just here, but globally. But before, we'll do that hopefully in the near future, and we could talk about this forever. But I want to just touch on the book a little bit more. Let me start with the title, The Hidden Root. I know you've obviously used this for a double meaning, right? So obviously the root as in like your root and in your teeth, and then what inspired you for the title?
Oh, it's mainly patience.
Yeah.
So I can give you many examples. I will just give you one example. Brazilian girl, 26 years old. She traveled the world to find a solution for a thyroid issue.
Mm-hmm.
She was diagnosed with Hashimoto. None of the endocrinologists refer this patient to a dentist, a biological dentist.
Mm-hmm.
But the thyroid is directly linked to the first and the second molar, upper molar.
Mm-hmm.
And unfortunately, in her case, it was greatly infected.
Wow.
She has an infected root canal on this particular tooth.
Mm-hmm.
So I'm not saying that was the only link to that. But when you remove this root cause or this hidden root,
Mm-hmm.
then of course you stop the bacteria to flow and to migrate every day chronically to this thyroid.
Mm-hmm. Wow. So, and I know you've spoken about quite a few things here in the book.
Patients, yeah.
Yeah.
Many patients.
Yes, exactly. So it's definitely a great read and super inspirational for readers and people to. Are you considering of doing it into an audiobook too?
Most probably. I would love to. Yeah, I would love to.
I think you should, because I think you'll reach a greater audience that way too.
Yeah.
You obviously mentioned quite a few journeys in here, and just give me a taste of some of the stuff that helped shape who you are right now after being in the UAE for 23 years. And as I said, the opening chapter is brought chills a little bit for me, because as a father myself, I don't think there is any possible situation in life where your child can be in danger.
Okay.
That could be worse than that, you know? So tell me a little bit about that, and if it's not too much to ask.
So my daughter, when she was, I have 3 children. Mm-hmm. My youngest daughter, when she was 15, we were traveling, and at one point she says, "Dad, I feel some limp into my throat area." So of course she was doing a lot of sports. She was very active. So we said, "Okay, let's have a look. Let's wait." And 15 days later, still the same thing. So I managed to brought her to one of my colleague doctor, mm-hmm. and she found out that it was not quite hard, not quite swollen. So she ended. We ended up finding ENT. Mm-hmm. We did a biopsy, mm-hmm. and we find out that it was cancerous.
Okay.
So we had to rush. We had to do the whole protocols with all these kind of protocols that goes with cancer treatment. But along the way, we read a lot of books with my wife, and we find out that we had to question the protocols, and we were not happy with the way it was presented and the way we were treating our daughter. Mm-hmm. So everything is fine. She's fine now, but that was the turning point.
It was also shocking for you because you lost your mother to cancer, correct?
Yeah. My mother died when I was 24 out of cancer. She was not smoking, and she died of lung cancer.
Lung cancer, yeah.
It was all these kind of things, and I wanted to have answers.
Yeah. So we share that in common also. I lost my mother for cancer too, but it was breast cancer, and it kept coming back until we lived in Beirut, Lebanon for part of my childhood, and they lived there all their lives. So it was very the approach to medicine was very basic.
Yeah.
Even though we have brilliant people. But the approach to medicine was very basic, so we struggled with that too. So I understand and sympathize having kids and so we share a few things in common, because also my daughter had something in her growth plate also as she was growing up, And that's, as you know, this is major, it could impact the rest of her life and all of that. So it was a journey trying to find out how, and again, in the same way, trying to approach, how doctors are approaching it, so it was a journey for sure.
And I'm sure that has impacted the way you see life and you treat your customer as well.
100%, yes, 100%. It changes everything.
Exactly.
It changes everything.
It changes your perspective of life and the way you want to do it.
Yeah.
And that was a tipping point, because I had at that time a very successful practice of conventional dentistry. And I shifted completely 180 degrees. And many of my colleagues didn't understand that. I lost patients. It was not a problem for me. It was not the problem. And then the ball was rolling into biological dentistry. And then people were starting following us, starting to understand, reading a lot of scientific studies, because you need to read biography, you need to read literature. And then slowly and slowly it becomes more efficient, more fine-tuned to our protocols. And now the ball is rolling, and we are very successful because people are understanding what we feel, and it makes sense to them.
Because it makes sense, I was going to say that. It's when something it comes from a true place, it just has no way except for it to be successful.
Correct.
Is to be popular because it makes sense to people. And from day one that I found out about what you did, I was completely taken by it, because it just makes sense. This is how it should have always been. And it's unfortunate that it took adversity for you to come across it, but considering the amount of people that you're helping, through you and everyone that works with, including your wife works with you, correct?
Right.
So you have such a massive community. I know that today is the Dubai Marathon, and you also ran with your team, and it's awesome. The way you approach everything, it's how it should be done. So I am incredibly and always in awe of what you do, and I always tell you that.
Because we share the same values. I've listened to you many times when you do lecture, when you do conference, and you're true to your audience, and they see that, they feel that, and the words that you're using, the way you look, and the way your attitude when you present, and you're convincing because you speak the truth, and that's meaningful for them.
Because when I do these things, I hardly ever plan. So I show up, and then something flows. It comes from inside. Like even now speaking about it, I'm getting chills, because it comes from inside truly.
From the gut?
Yeah, it does not come from not necessarily from my mind. It comes from somewhere, and it comes from the root of who I am. Considering we're talking about the hidden root, it comes from the root of who I am. And you're right. I mean, people come to me and say stuff. It blows me away, because I'm just. I don't know. I'm just I'm just saying stuff, and then it impacts people in such a meaningful way, and it's so rewarding, so incredible. And you do the same in your own way, not just in the literature or the clients that you work with, but also in the way you live and how you treat people, and everything that you do. And we overlap in quite a few things. So now, what is next for the David Roze empire? What are you working on right now?
So we have a lot of, as you mentioned, lots of patients, and we're very lucky, traveling to see us. And we would like to be closer to them.
Okay. So you're trying to expand internationally?
Yeah, I mean, we would like to go closer to them. I know for some people it's difficult to travel. And if we manage to find some place where they have the same kind of protocols that
you're thinking of Europe somewhere?
No, for now we're thinking of Abu Dhabi, maybe GCC. That's where we have a lot of people that
traveling
wants to come and see. And then later we will see. We'll see.
That's amazing. I'm sure you will make it happen. I'm positive that you'll make it happen for sure. So. Can you give me one or two perhaps cases from the book of how the hidden root has truly manifested itself? because you have some really interesting stories with clients that have come to you for one thing and then you found out something else. And I am aware of clients that we share about some of their interesting stories. But I want to try to inspire people to come and see you, to think of their teeth a little bit differently than to take them for granted. We think of them almost as a separate entity and not part of a whole. To say the least, perhaps one of the most important part of a whole. So I want to be able to try, I want people to hear you and be inspired by why should they be looking after their teeth and their gums and how is it connected to the rest of their body. So just give us some examples, just give us some of the amazing stuff that you normally talk about.
So people come to see us when they have unexplained medical symptoms.
Right, not just in the teeth, right? Yeah.
You have chronic fatigue, back pain, migraine, brain fog, these kind of symptoms that it's there, but you don't have a medical reason for that.
Explanation for it.
And then you need to find out.
Yeah.
And the mouth should be part of your investigation. I'll tell you one example that I share in chapter 3, because Sultan is a very dear patient of us.
Yeah.
And I actually wanted to have his name put in the book, the real name.
The mirror of the body.
Yeah.
Yeah.
So Sultan, when I met him with the family, with the mother, he was 17. One day he woke up, couldn't talk, couldn't walk.
Wow.
17. He was bubbly, he was young, he was
17.
17.
Wow.
Woke up, couldn't walk, couldn't talk.
Yeah.
So of course the parents were very frightened. A boy from Ras El Khaimah.
Okay.
Then he rushed to the hospital. Battery of exams, brain scan, MRI, you name it. Couldn't find anything. It lasted 2-3 weeks and still nothing. And then the mum remembered that 3 months ago, he had a root canal treatment performed. And she felt at some point that maybe it could be the reason. And then finally, to make sure it's stored, they came to us, we did a CT scan, we found out that there was a huge infection on this particular root canal treated tooth, we removed the tooth, and he felt better immediately.
And he was able to move and
so it took some days to
of course,
and weeks to walk again. But yes, he was fine.
Amazing. I mean, obviously, hopefully by now most people are aware that some heavy metal poisoning can be from teeth and fillings that were put years ago, and so there could be the source of that.
Diabetes,
Yep.
cardiovascular disease, neurodegenerative disease.
Yes.
They're all impacted by if you have an unbalanced microbiome or if you have a dental infection, particularly an infected root canal treatment.
Yeah.
And we see now in the literature more and more cancer, especially colorectal cancer, breast cancer, referring to a certain amount or a strong concentration of particular bacteria that should not be there, that are typical oral bacteria, but we find them in this cancer.
So there's direct connection, obviously. So it's going to travel through the system. They're not separate, and that's the point that we're trying to make, right?
Exactly.
I mean, your advice for people that have not checked what sort of fillings they have in their teeth, because up to when? Maybe a decade ago, people are still putting...
Yeah, I mean, we still have some countries who allow to have mercury fillings, for example. But now, the issue is not only with mercury filling, it's with conventional resin.
Oh, yeah?
Yes, because they contain sometimes some biphosphonate A, which is a very poisonous agent. And then when you put it as a filling in the mouth, it's like bonbons, You're licking it all day long, releasing all the BPA all day long.
Yeah,
so
of course.
It's not good.
So it's constantly being released into your bloodstream and into your gut.
So you need, and that's what we do. We try to find the best biocompatible resin to put in a filling.
Yeah. One of the clients that I referred to you also had a hip situation. He was actually having a hip flexor and one side completely, he was feeling really uncomfortable with it. And every time he would be in a stressful situation, or he would always feel it on that side. And then when he went to you and the corresponding teeth were directly connected to what is happening on his right side, and he was blown away by that, of how, when you showed them the map of, I have copies of that, I think you sent them to me. It's always fascinating to take a look at how the connection is there.
Yeah.
So I think it's really important for listeners and viewers to understand the complexity and the benefit of having a healthy oral microbiome and healthy teeth.
It's the entrance to the rest of the body. It's where you talk, you eat, you drink. It's central in your face. It's a real great position. And I always try to emphasize that to the patient. The whole body, you have nerves everywhere. And there's nerves going to the brain, the cranial nerves. And you have 12 pairs of cranial nerves. One is occupying 50% of the space of these cranial nerves.
Oh, wow.
It's the mass one, the trigeminal.
Yeah. Oh, wow. So I want to hear one more story from your book. Do you have any particular favorite chapter or part that you'd like to share?
Oh.
You have so many. Yeah.
It's very personal.
I know. Just one that is, because I really want people to reach out and get your book and read it. It is a must read. So give us one more tidbit, please.
I like the story where we see someone who had a neurodegenerative disease, and in fact it points out that when you have a root canal treatment, an infected one especially, you have leakage of endotoxin. And there's endotoxin past the brain, the blood-brain barrier.
Right.
And then by accumulation, it disturbs the microglia. There's cells that contribute to regulate the brain.
Yes.
And then at some point, by disturbing this microglia, it contributes to Alzheimer or Parkinson. So when you have this kind of patients, we need to warn them that, of course, you can save your tooth. Of course, you can chew with this tooth. But if it's an infected root canal treatment, it's affect and drain down your immune system, and not only your immune system, it drain down your whole philosophy, your whole brain.
Brain health is such a big topic, and especially, and it's, for me, it's a especially kind of a important topic to talk about in general, because a lot of my focuses on the last couple of decades of our lives and how it could be the most productive, hold on to our dignity. You've heard me say these things, and having, great mental health later on in life is super important. And I know so many people that are suffering because of that. And to understand or realize that one possible root cause can be a root canal, or it could be a tooth in your mouth that is causing that sort of poisoning and eventually leading to something as serious as Alzheimer's or any form of dementia. Yeah. It's just mind-blowing. It's mind-blowing.
And that's always what I said to our patients. Please do your homework.
Yeah.
Try to research the ingredient that you have in your oral care products.
Yeah.
Try to always find out what makes sense, and ask your dentist what kind of material he's using, and research yourself. You can do that.
Yeah, read the label, use AI, ChatGPT. We use it for everything, and sometimes very silly stuff.
Yeah.
But when it comes to our truly healthy, either lifestyle or the things that we put into our mouth, or supplements, or even interventions such as for our teeth or the toothpaste that we...
Exactly.
And we just don't read the label.
And if your auditor are interested in more literature, more scientific program, they can come. We'll have a biohealth event on the 11th of April 2026, where we have international speakers who take one aspect of biohealth and will contribute with scientific data of how we can improve life.
100%. I think I'm going to be part of that, right?
Exactly.
Yes. So definitely we'll put it also in the description at the bottom for people, and then obviously I'll talk about it a little bit more too. This is awesome, and I know you and I can talk forever about these things, and we will do it again. And I'll definitely see you on 11th April, and I'll see you before that too. So thank you again for joining me. I really appreciate it, and thank you again for the book and for bringing this to light and for people to be able to read what you have in here. You guys, you have to check it out, The Hidden Root by Dr. David Roze. It's available everywhere. Thank you so much again for joining me.
Thank you very much for invitation.
Thanks again, you guys. So thank you for listening or watching, and see you next time.